And I said, come over, come on over, you'll say.
Good morning, ladies and gentlemen, and welcome to the Town of Portland podcast. And I'm your host, Dave Kosminski, and we're live here in the Town Tech Educational Podcast Studio at Portland High School. And it is a balmy 94 degrees outside, so I go from there. But this is going to be our episode number 38. And with us on the phone, our first selectwoman is going to be a few minutes late, but we're going to start off with our frequent flyer, Mr. Russ Melman, who is the Chatham Health Director for the Chatham Health District. So how are you, Russ?
Doing well, Dave. Thanks for having me again. Episode 36. Wow.
No, this is 38.
38, goodness.
38, my God. You know, and you've been on most of them.
Right. Well, I appreciate the opportunity to speak directly to residents of Portland and anybody else who listens to the podcast. So
we're getting
I think
a lot.
It's been a great megaphone for getting health information out there and letting people know what's going on around town and around town of Portland. So I think it's been great, and I'm doing well. I'm getting a little bit of a breather. Things have stabilized here, so
yeah.
Actually, I get to leave on time sometimes, which hasn't really happened.
Wow, that's novel.
Yeah. And sometimes I'll have a whole weekend where somebody doesn't call me. I mean, I feel like I'm doing something wrong sometimes when
well, that's
I
the thing.
only work 40 hours or something.
And especially when your wife says, why are you home?
Right, exactly. My kids actually ask me when I come home on time, like, what are you doing home so early? And I have to tell them, well, this is actually when I should be getting home.
There you go. Fantastic. So anyway, I guess now I guess we're considered in the dog days of summer. So and I think now that we've gotten through the school year, we just did our wrap up with Dr. Britton, in fact, last week, and I guess he had to get some notifications out as far as in relation to what he's mandated by to do by the state in order to, I guess, get his federal money and so forth. So we did that, and so he's got things wrapped up. So what's on tap for the? I thought maybe we could, now that summer is here. As far as that goes, I know things have loosened up. People are starting to travel a little bit, as well as kids are going off to camp. So what's the latest update on the travel advisories and camp protocols?
Sure. So CDC still has travel advisories for international travel. So if people are planning international travel, the first thing they should do is go to the CDC website and look to see what concerns the CDC has indicated exists relative principally to COVID-19 in the countries that people are traveling to. Some countries are really having a hard time with COVID-19 still. Others are having a better time as we are, but people should check the CDC website to find out what the travel advisories are and what the requirements are. Mm-hmm. So there are requirements, depending on what country you're going to verify that you've been fully vaccinated before you can move around the country, or present a negative test, or in some cases both. Some countries, for example, Israel, requires not only for you to be fully vaccinated, but when you land, you have to go immediately before you can move about the country freely to get your antibody levels checked.
Okay.
So they don't even just take your vaccine card as gospel and say you're fine. Mm-hmm. So depending on where you're traveling to, you should find out what the requirements are vis-a-vis being fully vaccinated, getting tested, or getting tested when you're there to demonstrate that you've got immunity to COVID-19. Mm-hmm. And you should also be prepared for what the lockdown situation is.
Right.
There are some European countries right now, for example, that are going back into some lockdowns. So if you're planning to travel and do touristy type things overseas, before you shell out too much money doing that, you should make sure you're going to be able to do the things you actually want to do when you get there. I wouldn't just assume that because in the United States, people are moving freely about the country and the economy is just about fully open everywhere.
Sure.
That it will be the same thing when you go to, some other country.
Right.
There are some other states also that have different requirements. So, in Connecticut, indoor mask wearing, for example, is required only for people who are unvaccinated. Mm-hmm. I was just in New York City visiting with my family, and just about everywhere, and I don't know if this is a state requirement, but everywhere indoors in public places you're required to wear a mask.
Right, okay.
So that's different than Connecticut, where if you're unvaccinated, you have to wear a mask. So in New York City, for example, everywhere you go indoors, you have to wear a mask.
Wow.
I went to the Metropolitan Museum of Art. You have to wear a mask. It didn't say if you're unvaccinated, wear a mask. It just said you're required to wear a mask.
Mm-hmm. Yep.
So just pay attention to just do some little internet research. CDC website is great. If you're going to go to a different state, just go to that state's Department of Public Health website and find out if there are any requirements.
Right.
Generally speaking, though, in the United States, you're going to find things that are very similar to what we have in Connecticut.
Sure.
With a few small differences.
Mm-hmm. Now, in relation to the international travel and so forth, and people that are going for passports now, is it when you go for a passport now, is it required that you have to have vaccination?
So, are you asking if people don't yet have a United States passport?
Yeah, I mean, if you're going to get a passport now, are the people or the federal government requiring you to have vaccinations to get a passport?
I don't actually know the answer to that question, Dave. I think it's probably unlikely. As a citizen of the United States,
Okay.
you are entitled to get a passport that identifies you as a citizen of the United States. So if you want to travel, you're identified as a citizen of the country.
Correct.
I doubt very much you're required to have a vaccine to get a passport, but the United States will not stop you from traveling if you're not vaccinated, but the country that you plan to go to may stop you.
I
So
see.
you could have a passport. If you don't have one, you could probably get one without being vaccinated, but it won't do you any good if you're traveling to a place, like I said, like Israel, which will require you to prove that you're fully vaccinated and prove that you are immune. So
Okay, yeah.
your passport won't do you much good if when you get there you have to sit in a hotel room at your expense for 14 days.
Right. Now, as far as in relation to airline carriers, are most airlines have a standard policy that you must wear a mask on a plane, or are they different?
Yes, in fact, I think it's pretty universal in all forms of public transportation around the country in most places. So from taxis to buses to trains to airplanes, yes. So if you are traveling in an airplane, you are required to wear a mask. I don't think it matters if you are fully vaccinated or not. I think most airlines are just requiring masks.
Okay.
There have been very widely reported incidents of confrontations between not only passengers and other passengers, but passengers and airline personnel.
Right.
My advice to anybody who is traveling for the first time in, say, a year and a half,
Mm-hmm.
be prepared to feel a little bit of anxiety and be prepared to, with some calming measures of your own, find your happy place. If you're somebody who, really, really hates to wear a mask, you've been fully vaccinated for a while and you've gotten used to not wearing a mask,
Right.
as frankly I have in Connecticut. I've already gotten very used to not wearing a mask. I've been fully vaccinated for many months, and as soon as the state mandate for mask wearing was restricted to non-vaccinated persons, I stopped wearing my mask. So
Right.
if I were to get in a plane right now, I might be sort of taken aback by having to put on a mask. Just be prepared to wear a mask.
Mm-hmm.
If you're not sure, just ask.
Sure.
And, don't get upset with the ticket agent or the person.
TSA agent. Or,
Yeah, that's not really going to get you very far, except perhaps on the no-fly list. So I would just, recommend that everybody be prepared to wear a mask and when they're in an airport, when they're on an airplane, and when they're in any other kind of public transportation, wherever their destination is, whether it's a bus or a train or a taxi.
Sure.
Be prepared.
Yeah. Okay. Now I know with summer coming, most kids now are or parents are looking for camp opportunities for their children. Is what's the protocol now for camps as far as that goes?
Yeah. So day camps, especially camps that are occurring outdoors, masks are not the rule. You don't have to wear a mask when you're outside a camp. I think the rules for overnight camps are somewhat different. I think there is no mask requirement anywhere in overnight camps. Or indoors, you're going to have to wear a mask, except in your place where you sleep.
I see.
So if you're sending your child to overnight camp, they should be sent with a mask, but they should also be prepared to not be required to wear a mask when they go to wherever it is that they sleep. And that, I think that's a comfort level for parents.
Right.
If your children are fully vaccinated, I would send your child to overnight camp or any other camp.
I see. Okay.
If my kids were not fully vaccinated, I personally, this is my personal comfort with risk.
Uh-huh.
I wouldn't be sending my children to overnight camp.
I see.
If they weren't fully vaccinated. It's just my personal comfort level with risk. So you should, understand what the requirements are going to be, and if you're not comfortable with no mask wearing in the cabin with other kids who might not be fully vaccinated themselves, then you should think very carefully if that's the kind of place you want to send your kids.
I see. Susan, is that you that came in?
It is, yeah. I'm actually down at our riverfront, Dave. So that was a big truck driving by.
Oh, okay. I was just wondering. It sounded like you were dragging a chair across the floor or something. So,
No.
okay, good. I'm glad that you're here. Okay, fantastic. Russ is just giving us the, the camp advisories as far as for, children's camp, day camps, and so forth.
Great.
So,
yep.
Yeah, I mean, we know outdoor spaces are very, very low risk for COVID-19. I mean, if I think back to where we were at this time last summer, it was actually in a very similar place vis-a-vis COVID-19. Very little transmission all of last summer. Now, the economy wasn't really wide open like it is now. Mask requirements indoors and outdoors, in all places that were public was the rule. So we were in a very different place than we are now. But in terms of the number of cases we saw, we were at basically the same point, very few cases.
Nice.
So I think, people should just be mindful that wherever they go, they should bring a mask with them just in case the requirement is, or the business, or wherever they are, asks you to wear a mask.
And now the situation with the variants out there, what's the status with that now?
Sure. So the State Department of Public Health does track variants. They do take a certain number of positive samples from the population and test them for the presence of the principal variants of concern. I think there are 3 or 4 at this point circulating in Connecticut. What has become the dominant variant is the UK variant, B117 variant. It's a more infectious variant, slightly more virulent, so it causes slightly worse symptoms also. That's the dominant variant right now in the state of Connecticut, but the vaccines that we have are highly effective against them. So that's why we're just not seeing much transmission. Many people are vaccinated at this point. So even though we've got some variants circulating, we're not seeing much transmission. The variant that's on the tip of everybody's tongue at this point is the Delta variant. That's the one that emerged from India during their massive COVID crisis, which is still going on right now. They're really not out of the woods, but and that is even more infectious. And the thinking is now that will become the dominant variant that is circulating in Connecticut at some point over the next few months. Just as the B117 variant took 2 or 3 months to become the dominant variant in Connecticut when it first emerged, that's what's being predicted for Connecticut with the Delta variant. Now, the vaccines that we have are effective against it, slightly less so, but they are still very effective. So I wouldn't expect to see, massive outbreaks among people who are vaccinated. I think you're very well protected against the variant. So I'm not too concerned. But for people who are unvaccinated,
right,
when you have a more infectious strain that is circulating, the rules that we were following before about how we can mitigate the spread of that virus still apply, but even more so are important for people who are unvaccinated. And it is even more important for those who are unvaccinated to initiate vaccination at this point. Because once we hit the fall, September, October, last summer, even in August, we started to see a small uptick.
Right.
But September, October, November, if we are at the point where we're at now in terms of vaccination around the state, which is about 2/3 of the state having been initiated vaccination, we're going to see surges. We're going to see clusters of cases because it's a more infectious variant.
Right.
And it will impact people differently than the traditional variant, than the Alpha variant, the one that was circulating for the better part of a year. So I think people just need to be mindful that if they thought that if they're not getting vaccinated because they think COVID-19 is not a big deal, to really reconsider.
Right.
It is a big deal. It causes a lot of illness.
It's still there.
It's still there. We have more infectious variants that we're still learning about, frankly. The Delta variant, we're still learning about it. So I would hate for somebody to think it's not a big deal and get infected and bring it back to their family and for somebody to have a bad outcome as a result. So
now as these variants, kind of evolve and so forth, do you think the CDC is going to come out at some point and say to vaccinated people that you might want to consider a booster shot?
If they find that whatever variant that is circulating evades the immunity that has been conferred by vaccine, then yes. If there is a vaccine out there that will confer immunity against the variant, that's sort of the key. Getting boosters when the booster doesn't protect you against a given variant doesn't seem particularly useful.
Right.
It'd be like getting a flu shot for COVID-19. The flu shot is not going to protect you. So
Right.
I think they have to understand a little bit more about the Delta variant and the other variants that are circulating before they say, we recommend a booster because this particular booster works, this particular vaccine works better against this predominant variant than another. And they are actually doing studies right now where they are giving people boosters with vaccines that are different from the vaccine they got initially.
Ah, okay. All right.
So they are now studying, for example, people who got the Johnson & Johnson vaccine. They are now giving them one of the two mRNA vaccines that are authorized, so
Right.
Pfizer or Moderna, and vice versa. And they're sort of mixing and matching.
I see.
So they are studying whether or not you can get a better level of immune response,
Sure.
better protection against the variants, by using boosters with different vaccines.
Well, I think overall, the vaccines have been highly effective on these variants so far. So, which is a good thing.
Yeah, that's a great thing, and I think we've gotten calls from people, as many people as there are out there who seem to be hesitant to get a single vaccine
Right.
at all. I think there are just as many people out there who are looking to get more vaccinated. So we get calls to our office from people looking to get a different vaccine than the one they got already.
Mm-hmm.
We got a call just yesterday from somebody saying that they wanted to get the Moderna vaccine because they had been given the Johnson & Johnson already. And they heard that was a thing that was happening and that it was good for them.
Ah.
So for anybody who's thinking right now, just, give me one of everything, kind of, until there's actually a recommendation that is both safe and effective.
Right. Right.
Don't bother calling your physician or vaccine provider, and please don't lie to any vaccine provider and say that you have not been vaccinated yet just to get that vaccine. The safety studies have not yet been completed on that kind of approach of getting a different kind of vaccine as a booster. So if you've been vaccinated, great. You should trust that protection. You should enjoy all the things that you can do now that you're vaccinated without much concern.
Sure.
And wait until the safety and efficacy studies are done with those boosters before you start going out and try to get one.
Right. Right. Excellent. Excellent. Well, I think information. Well, what's our infection rate now as far as the numbers go?
Oh gosh, very low.
Okay.
In Portland. Now, the updated numbers will come out today, and I'll send out my report either late this afternoon or early tomorrow morning. But in Portland, in the the previous 2-week period that we reported, there were 2 confirmed infections.
Oh, okay.
2 in Portland.
Got it.
So, in all of Chatham Health District, the last time we looked, there were 8.
Oh,
So
okay.
we're under 1 case per 100,000 on an average daily basis.
That's a good thing.
Which is a great thing.
Yes.
It also makes contact tracing much more effective. So
Sure.
when we reach out to interview people, we can understand in much greater detail where they were likely exposed, who they exposed, and put in those recommendations and make those phone calls. It's actually a lot easier now that people are vaccinated. Many of the close contacts that we reach out to when we're doing contact tracing have already been vaccinated, so
Yeah.
they don't have to quarantine. We say it's the first question we ask. You've been in close contact with somebody with known COVID-19. Have you been fully vaccinated? The answer is yes.
You're good.
Have a great day.
The circle is a
start
lot
to feel
smaller.
sick. Sorry, what day?
The circle is a lot smaller.
The circle is a lot smaller, exactly. So it's really good. And in Portland, the numbers are great. 67% of Portland residents have initiated vaccination. Around 62% are fully vaccinated. It does vary by age. So, older adults, working age adults, more than 2/3 have been vaccinated. So
Good.
great news. People who are above 16, very, very high levels of immunity. Children, though, 12 to 15-year-olds, were only at about 30% having been fully vaccinated in Portland.
Ah,
So
great.
if you're a parent and you're listening to this and you're wondering, should I get my child vaccinated, should I not? The answer is yes, you should. They're very safe. They're very effective. There's a lot of myths out there. Go to cdc.gov. Learn about the myths that are out there. Educate yourself about the safety and the efficacy of these vaccines from a trusted source and get your kids vaccinated. The time is now because, it's going to take you 6 to 8 weeks to become fully vaccinated, and by that time, school started again.
There you go.
If you don't want your child, if for nothing else, you don't want your child to be swept up in contact tracing when they go back to school and then have to quarantine and be out of school for a week or two in the fall, get them vaccinated.
Yeah. Now, what's the forecast for children under 12? Is that something that's coming, or as far as for the fall?
Right. I'm not sure what exactly you're talking about, but we my hope is that we see the number of children You say children under 12?
Yeah, I mean, right now I think the vaccines are for 12 and over. Or
Yeah, that's right. Probably not until after the beginning of the school year where we see vaccines that are authorized for use in
I see.
children under
Okay.
12.
Right. So.
So if your child is basically in elementary school, has not yet reached middle school,
Yep.
they're not 12 years old, I would not count on them being able to be vaccinated before the start of the school year.
Okay. All right.
So, I think the state is working on, both the CDC and the State Department of Public Health are working on their guidance
Yep.
for schools for the fall. The hope is that they will get that guidance out in early July.
Mm-hmm.
So for anybody who's waiting to see what the state is going to say about, for example, masking in schools,
Right.
or social distancing, or contact tracing, or anything like that, you're just probably going to have to wait another week or two, and those guidance documents should be out.
Right.
Now, go ahead.
Now, as far as in relation to the governor's emergency powers, I think those have been extended into July now.
July 20th, I think, is the date that they've been extended to. So all the executive orders that have been issued under that emergency declaration are still in effect, including the mask mandate for people who are unvaccinated, who are in indoor environments, and schools, and public transportation, and healthcare settings, and nursing homes. All still require masks indoors by everybody, regardless of the vaccine status. So that's still in effect through through July 20th. I can tell you that I get plenty of emails and phone calls from parents on both sides of the spectrum, some asking if I have any sway or influence to lift the mask mandate in schools, and just about as many others asking, my child is unable to be vaccinated because they're not of the age, and please don't lift the mask mandate when school starts.
Right. So you get both sides of the spectrum.
Both sides. Parents who feel very concerned that there won't be masks required when their child's vaccinated in school, and parents who think masks are not necessary, and why are we bothering with masks with
Sure.
children when they are less likely to have severe outcomes from COVID-19. So,
Awesome.
Wait a couple more weeks, and hopefully that guidance will be out.
That'd be great. Well, I appreciate it, Russ. Thanks so much. So forth. Before we, Susan, I think you're up next. Okay, Russ, I don't know if you can hang in there for a few more minutes and so forth, because I want to get your, after Susan does her update, I want to get your take on the legalization of cannabis and all that kind of stuff.
I'd love to talk about it. Can I just say one more thing
Sure.
about vaccinations, and that is, we are going to be issuing basically scorecards or reports for each of our municipalities, Portland included, that is going to detail, in as granular a way as we can, the vaccine campaign in each of the towns.
Okay.
It's going to be talking about age breakdowns and breakdowns by race, ethnicity, and that's really what I want to focus on really briefly.
Good.
Our white residents are very much taking up vaccine.
Uh-huh.
Our Native American, our Asian and Pacific Islander populations taking up vaccine. Our black populations are appearing to be extremely hesitant to get vaccinated. In the town of Portland, only 31% of our black residents have been vaccinated.
Ah, okay.
So we're working this summer to focus on those populations. We're getting out in the community and doing pop-up vaccine clinics. We're going to be offering incentives for people to get vaccinated. Think gift cards in the amount of about $25 to get vaccinated. We really want to remove every barrier possible to anybody to get vaccinated, and that really, looking at these numbers by race, ethnicity, gives me some concern. So
Sure.
We're focusing on equity this summer, and if you see us out there, come and talk to us, ask questions. We'll be at every event you can imagine with a table doing education and vaccination. So we'll see you out there this summer.
Great. Fantastic. Thanks, Russ. I appreciate it. All right, Susan, you're on deck, kid. Yeah, so you're down basking by the riverfront?
Yeah. Can you hear me okay, Dave?
Yes, you're a little bit echoey. Go ahead. Let me.
Okay. Let me just, that might be a little better. I'll take it off speaker.
Yeah, that would be great.
Yeah, we had actually a special Board of Selectmen meeting this morning at 10 o'clock.
Yeah.
And we were at the 248 Brownstone Avenue, which is one of the pieces of riverfront property the town bought in 2019.
Uh-huh.
And we were talking with our licensed environmental professional, which is Amy Valancourt. She works alongside a couple of other staff at Ty and Bond.
Yeah.
And they went over for us, Dave, how the cleanup is progressing and what the future is. As our listeners may be aware, this parcel used to be an active asphalt and oil distribution site right on the coast of the Connecticut River, and it is right next door to the Riverfront Park where we have all of our concerts and other activities. Our labyrinth was just built. So it's natural that we would be trying to clean up this area, which was vacated about probably a dozen years ago. And so they went over today for the selectmen a lot of the work that they have done, including the removal of 5 of the above-ground, great big, huge oil storage tanks. Those have been removed, and fortunately, the Connecticut Scrap Metal Company out of North Franklin, Connecticut, did that job for no cost to the project. That has saved the project about $200,000
Wow.
in the budget. So we're very grateful for that. Ty and Bond got us that company, and the company just did a fantastic job last winter in removing all those tanks.
Yes.
So now what we're discussing is going out to bid for a remediation contractor, somebody that'll come in, remove the required soil that Ty and Bond, our professional environmental folks, tell us has to be removed. And what we're looking at is probably capping a lot of the matter that's in the soil with asphalt. So at 222, which is where it's already a sort of a parking area, that will likely be covered with asphalt and a minimal amount of removal of soil from that site. A little more removal probably from the next lot, which is 230.
Yep.
And then at 248, where the big old tanks were,
Right.
in the past, the former owner did have some oil spills. So we know and we have accommodated in our $750,000 budget, which is paid for by the state of Connecticut by a grant that we have. The bulk of the cost, we guess, will be from that 248 Brownstone Avenue. So we're going out to bid in July and in August, and we hope by September, October, that initial covering with the asphalt will occur at the 222 and 230. And then in the spring of 2022, which is when we're scheduled to complete the work, 248 will have also been cleaned up and capped, and will be, during the course of this year, looking at some potential tenants, potential companies, restaurants, people that might be interested in looking at this property to place their business.
Sure.
The entity, the state agency, is Department of Economic and Community Development, so they'll be working with us to make sure that we do everything right and that we're able to get a good contractor and then market it and get back some of the money, put it back on the tax rolls perhaps. Whatever the community feels is good for us, we will do.
Right.
So it was a little sticky out today in terms of being outside, but there was a nice little breeze from the river, so
that's
we
good.
were okay. The meeting ended a little after 11.
Okay. All right. Yeah. And
So it's a big project, and it's something we really look forward to. I know, speaking with our health department, they're always encouraging us to clean up wherever there might be contaminants to prevent any possible problems down the road for our well-being and our health.
Yeah, in fact, some of our town texts, we took some video of them taking the tanks down, so that's on our website if somebody wants to view that. Those big machines that were chewing up those tanks and so forth. That was kind of interesting, but that was great.
It was, yeah. Yeah, I'll have to look that up. That'll be interesting to see. Yeah, definitely.
All right, so what's your plans for the summer, kid?
Plans for the summer.
There's
the splash pad's open today.
Yep.
If you want to go out.
Okay.
Splash around all weekend, weather permitting.
Yep.
We have a staff person that'll be there to assist people and make sure the bathrooms stay open and clean, and that our youngsters are able to have some fun. Park and Rec is up and running with their summer camp opportunities, and I know the Portland Library has a lot of activities the summer. The last 2 Tuesdays in July
Yep.
and the first 2 Tuesdays in August, Parks and Rec, along with Brownstone Club, will be co-sponsoring riverfront concerts in the open. And we'll look forward to some summer fun at a riverfront and enjoy this nice warm weather.
Great, fantastic. Well, it's certainly. I guess we're going to get a little reprieve from the heat and humidity this weekend, but we got I guess some slight chance of showers. But it's going to be a holiday weekend. It's going to be a long weekend, so people can get outside, enjoy, and like you say, the splash pad will be available, and you can get out there and cool off a little bit and enjoy the park.
Yeah, sounds good.
Fantastic. So, all right. I think Russ, are you still there? Or I think.
Yep, I'm still here.
Okay. Susan, is there anything else that you need? Do we need to go over? Susan, are you still there? Apparently, she's not.
We had a lot of
No,
Susan.
I am here. I put it on mute so that I wouldn't get feedback, but I am still listening.
Oh, okay, cool. All right. Anything else, Susan, that we need to go
No,
over?
that's it for my report for now, Dave. Thanks for the
Awesome.
thanks to
Well-
let folks know.
Hey, thanks for jumping in on the phone, and appreciate it. And Russ, while you're still on the phone, okay, obviously you know that the July 1, a lot of new laws went into effect, and I know I've been dealing with some of the fallout from them. In fact, we had an issue at the town hall yesterday with all of the new requirements on the phone companies to limit the robocalls and so forth. We had people had problem calling into the town hall.
Oh, wow.
So
Well,
I-
always bumps in the road with new laws when they get rolled out.
and it was all configuration and so forth. So I've been working for 2 days with Verizon and AT&T. So it would go from there. So anyway, so obviously one of the new laws that was passed, with the legalizing marijuana in the state. Now, how is that going to affect the health districts?
Well, in terms of the way the health district operates or any of our core mission or anything like that, it's really not going to impact us directly. But in terms of its impact on public health, I think it's been pretty clearly demonstrated where, and I don't even want to call it legalization because, the possession of marijuana has been decriminalized in the state of Connecticut for years at this point.
Right.
It really is about marijuana commercialization.
Uh-huh.
So this is really just about allowing people to grow it, transform it, package it, label it, and sell it in a store.
Uh-huh.
More than it is about legally possessing it. Because
Okay.
It really hasn't been a crime for a few years, like I said. So
Okay.
in terms of public health, I think the implications are pretty clear. It's going to have a negative impact on people's health and well-being, and that mostly will impact children. But the levels of addiction with marijuana these days, because of the high levels of THC, not only in the plant but in the concentrates and the other products that are made from marijuana now, are the levels of THC are so much higher that the degree to which it can become addictive is much higher. So for anybody who thinks, they're much older and they're thinking back to the 60s and 70s marijuana, they're my generation, they're thinking back to marijuana from the 80s, 90s, and even the early 2000s. The marijuana of today is much, much stronger, and so it is much more likely to cause addiction. And it does cause real addiction.
Sure.
So for people who said marijuana is not addictive, it is. I think the science has proven that.
Mm-hmm.
So we'll see more addiction. We will see more children get their hands on marijuana because the amount of marijuana and the different types will increase in households. The packaging, the types that are available from, especially the edibles, chocolates, gummies, things like that, things that kids like to eat, frankly.
Brownies.
Brownies, what we've seen in other states is children, either deliberately or not, will get their hands on these products and they will consume them and they will have bad outcomes, end up in the emergency room. Again, typically you don't see the kinds of outcomes you see with other drugs. So I don't want to make the claim that if a child eats a pot brownie, they're going to die or their liver is going to be damaged irreparably or anything like that. Those things don't happen, but they can have a very, very, very bad experience. They can end up in the emergency room, and it's can, especially the younger somebody is, when they begin to use a mind-altering substance, the more likely they are to become addicted to that and others.
Sure.
as an adult. So I think the public health implications are clear. I'm a little bit disappointed that the public health protections in the law were not stronger.
Mm-hmm.
Principally, I was hoping to see minimally caps on the concentration of THC. And I hope that comes down to somewhere in the area of 15% or lower,
Okay.
which was what was recommended. So I'm not a big fan of this piece of legislation, but I do understand the arguments that are made that people are getting it anyway. They're going across state lines and getting it anyway.
Right. They're basically looking at it as a cash cow.
It's there are tax implications.
Sure.
Let's not pretend like this is about equity. It's really not, because again, it's been decriminalized for many years at this point. So, I bet you if you asked Captain Millardo in the town of Portland when the last time it was that he actually arrested somebody for possession of marijuana, he probably couldn't remember.
Right.
So you could probably get him on here. Maybe he would dispute that, but that's just my guess.
Sure.
So, the old argument that we're filling our prisons with people for petty possession of marijuana is an old argument that just doesn't stand true anymore. So,
Right.
I'm not a big fan from a public health perspective. On a personal note, if an adult wants to use a mind-altering substance, they're not going to hurt anybody else, and they're not going to harm their kids, and they're going to keep it away from their children, go right ahead. I'm not a big fan, but if you want to do something, you shouldn't be arrested for it. I'm fully in agreement with that.
Yeah.
It certainly shouldn't wreck your future career opportunities. So I know the other law that was passed was a clean slate law in the state of Connecticut.
Well, sure.
Big fan of that one. 7 to 10 years after you commit Class D or E felony or misdemeanor, it can be expunged from your record.
Right.
Big fan of that because that has positive public health implications. But
Right.
in terms of marijuana, I'm not a fan of seeing big green marijuana leaves on a store in Main Street that my kids get on a bus and every day go to school and drive by.
Right, right. Well, the other thing too that I think that's going to, have to wait and see how it shakes out. But basically, places that you can smoke marijuana. I think.
Yeah. Correct me if I'm wrong, but I believe municipalities under this law are required to set aside spaces, public spaces, where residents can use marijuana. Is that? Am I getting that right, Dave?
Well, I know they have to provide spaces for smoking. Now, I don't know. This is going to be. Most public buildings from a standpoint of, are both state and federal are basically non-smoking
Right.
buildings as far as that goes. But I think, employers are required to have a designated smoking area. Now, I don't know if that's in effect for the town. I don't know, Susan, if you're still on, whether you're up on that at all.
Yeah, I know, Dave. I talked with Mary Dickerson, our town planner. She's going to a seminar within the next couple of weeks to gain some more information, and we'll be proceeding in the best way we can to keep everybody safe and healthy.
Sure.
I mean, that's number one. We don't allow smoking, of course, on our campuses for our schools or public buildings. Smoking is smoking. in
Right,
that
exactly.
regard. But in terms of the retail establishments, how those are allowed or not allowed, that is something that would fall under the purview of planning and zoning, and so they'll be discussing that, and I'm sure coming up with a good plan.
Yeah, exactly.
Yeah, anything that can reduce the sort of the normalization of marijuana use, especially among our youth, is something I'm supportive of. So, the law is what it is. It's it's passed. It's coming. July 1st next year will be the first opening, I believe, of retail sales of marijuana in the state of Connecticut. I would just hate to have it just be so normalized in our towns that kids just see it as something that's kind of a rite of passage where, parents start giving their kids their first joint when they're 16 because, they want to be the first to give it to them because they know where it came from, kind of like alcohol. Those are the kinds of things that I want to see. And, most of our towns, I'm actually not sure if Portland has a sort of a youth substance abuse prevention coalition, but many towns do. If you're curious about what your town is doing in terms of keeping children safe when it comes to substance abuse, sit in on your next Youth Service Advisory Bureau meeting or your Youth Substance Abuse Prevention Coalition meeting, and just hear what they have to say.
Sure.
You'll learn a lot.
Yeah, in fact, Russ, our Youth Service Administrator, Mary Punt, retired just this past week, and we have an interim person, Meg Scotta. And so she is going to be, at least for the time being, putting together some of the schedules and some of the activities. And this is certainly something that our Youth Service Bureau is always been on top of, and they'll continue to do so under Meg. We're still recruiting. We have some applications for that job, but if our listeners know of anyone that would be interested in the permanent position, we wanted to take a look at a few more applications, and then we'll be interviewing folks and hopefully a permanent replacement in the early fall.
Nice. That would be great.
That's great. Well, Mary was a real asset, especially during COVID. I got to know Mary very, very well, and she
did a great
she's
job.
a tremendous asset. She'll be missed, but hopefully you find somebody who's good, who's got some energy and some ideas, and can bring those to the table.
Great. Fantastic. All right. Great, guys. Good discussions.
Very good. Maybe we'll do a special on cannabis. That would be
there. We go.
And the health department, I think, and planning. I think that might be an interesting future episode, Dave.
For sure. Absolutely. Well, anyway.
Love to do that.
Well, guys, Susan, thank you for coming on. And again,
you.
Russ, as usual, thank you for all your awesome information and keeping our listeners tuned in on what the latest and greatest in the health arena is as far as that goes. So instead of signing off with "Stay home, stay safe, wear your mask," we're going to say, go outside, enjoy the weather, and have a great summer. So.
Plan. Yeah. Thanks, Dave. Thanks, Russ. We'll see you later.
Yep.
Awesome. So that wraps up our basically our episode number 38 here. And again, we're at the Town Tech Educational Podcast Studio with our guests, Miss Susan Bransfield, and our health director, Russ Melman. So again, enjoy the summer, and we'll catch you on the flip side in a week or so. So thanks so much for listening, and stay safe and enjoy the summer. Thanks. Thank you for joining us today. I'm your host, Dave Kosminski. Please tune in every week for new and relevant conversations about the town of Portland. You can find us at portlandct.org or at YouTube/Town of Portland, and now wherever you listen to your podcasts. If you've enjoyed our podcast, please consider subscribing and sharing with friends. This podcast was produced by the Town Tech Educational Partnership Program, which is a partnership between Portland High School and the Portland Town Hall. If you're looking to start a podcast for your business or organization, check out towntech.org/podcast to learn more.